And now on the line is Breda Gahan, a Global Health Advisor with Concern Worldwide. Breda, welcome to the programme.
Thanks, Darren. Good to speak with you again, and hello to all your listeners.
Okay, Breda, we're doing this interview today to talk particularly about the national and international response to try to end HIV and AIDS. But I understand that you are a Global Health Advisor in general with Concern. And bearing in mind the COVID-19 pandemic we have since last year, could you tell me how you are getting on with your work in general with Concern since our last interview?
Thanks, Darren. Well, it's escalated and increased on every level. It's a case of doing everything in terms of our program responses in education, my area health, and livelihoods to protect and advance health, reduce extreme poverty, and with our emergency response work in conflict-affected countries, all within the context of COVID-19, both here in Ireland and in all 24 countries where Concern is working over the past 15 months. I mean, everything has changed. Everyone has been impacted and affected in some way. It's astonishing, actually. We've hardly had time to think and catch our breath in the last 15 months. But with our Alliance 2015 NGO partners in Europe in October last year, we did a study in the countries of the South where we're working to hear directly from men and women, over 16,000 of them, in the 25 countries across the 4 continents. And basically the impacts of COVID are impacting on them in every way, especially in terms of income, food security, access to health services, schools closed, remittances down as people were returned home from the Middle East and other countries, and even the mental health of households has been affected, even if they haven't been directly infected with COVID. And I would actually say this time now in 2021, the populations Concern is working with, the extreme poor, are more impacted a year later than they were this time last year. In fact, many people thought COVID was restricted to the USA, Europe, Ireland, Australia, northern countries. But increasingly, I guess you've been hearing, Darren, in the past few months, particularly in highly populated areas in Africa and Asia, people are affected and more people are being infected and dying, including health workers. At the height of it, at the end of last year, I mean, we learned from our study with our Alliance 2015 partners that, health service delivery was down by about a third, as health workers weren't going to work, encouraged to stay at home. Poorest people themselves were afraid to go to the health services for the basic vaccination services for children, malnutrition, safe delivery in terms of childbirth. And even some people living with HIV were afraid to go to pick up their essential medicines in terms of antiretroviral treatment. A bit like Ebola in the past in Sierra Leone and Liberia and Democratic Republic of Congo. Once there's an outbreak of an infectious disease, often people, as in Ireland, tend to keep away from the health services. And a big impact now this year, as the pandemic continues well over a year, is lack of access to affordable food and food production. And people say they just can't earn their income. People are taking risks in terms of livelihoods and survival. And everybody is feeling a lot less well off than they did pre-pandemic. There are conflicts and mental health issues inside households and communities, and we've learned sadly that sexual and gender-based violence has increased in households here in Ireland and in countries where Concern is working. And it's especially a risk for adolescent girls and vulnerable women. And, from the beginning, a bit like the HIV AIDS epidemic in the past, our work has been to protect Concern staff, our partner staff, and the people we work with. Do no harm. We do not need to bring COVID-19 into the target populations we are working. So, we're planning scenarios in terms of our work in education, health, livelihoods, distributions, to where we can maintain the protection mechanisms we're doing here in Ireland: hand washing, mask wearing, physical distancing. So if we can, no close contact, no touch with our colleagues and the target populations we're working with. But that's not easy, and it's a big change. As you know, in Africa and Asia, people love to greet, shake hands. It's a new behaviour for all of us. Obviously, in some instances, and especially in health, close contact is necessary, but maybe not touch. Even giving a polio vaccination, you have to hold the polio ampule, but you don't have to touch the child. But in terms of giving actual vaccinations, contact and touch is necessary. And it's really important we are able to protect the Ministry of Health partner staff we're working with in all our countries. And then there's the whole issue of PPE, personal protective equipment, and getting the necessary amount in country to protect the people who are directly providing the services. As in Ireland, health workers are reaching burnout, I would say, a year later. And now it's only beginning, as you're hearing on the news. The COVID-19 vaccination rollout in Africa and Asia, way behind where we are in Europe, USA, Australia, New Zealand, and elsewhere. And we've been fortunate in concern and with Irish Aid partners to secure funding to support the vaccine rollout in Liberia, Sierra Leone, and Malawi, supporting on increasing people's knowledge as to the importance of uptaking the vaccination and continuing with the preventive measures so that we reduce transmission. Also working with the People's Vaccine, the COVAX initiative, advocating, as Mike Ryan with the World Health Organization keeps saying, nobody is safe until we're all safe and protected through the vaccine and the safe practices. But for extremely poor people who often lack soap, water, income, food, it's an invisible virus, again like HIV. It's difficult to continue these practices now 15 months into this pandemic. I do believe, with concern, and our donors, Irish Aid, our DOCUS network partners, we will be responding to the poverty impacts of this pandemic going well into the end of this year, and certainly I would say through 2022, maybe even up to 2025, depending on the global economic impacts. I better stop there. I've said a lot.
Okay, I'd like to come back to you again in a few weeks or a couple of months, maybe talk about COVID again, because this interview we're doing today is we're going to talk about HIV and AIDS. Just to follow up on what you're saying there, you're saying that economic impacts are huge. I think it's going to take, as regards to health response in developing countries, I think we're going to have to, like the governments that give overseas development aid to poor or to organisations in developing countries or to governments, I think in the Western world, we're going to have to wait, I think, until most, if not all, people in these Western countries like Ireland have the vaccine, and then there'll be more space, I think, to kind of focus on poor countries. That shouldn't be the case, but I think that's what's going to happen. Like Ireland, I think just over 50% of people have either got a full vaccine or they've got their first dose. So if that's over 90%, I think hopefully there'll be more of a focus amongst the Western countries on helping our colleagues, our friends in poor countries, But
well, a bit like HIV, every infectious disease now is only a plane or a boat ride away. So by protecting others and people most vulnerable and at risk, we protect ourselves. But it's a big political debate, and the logistics of delivering it safely are very challenging for ministries of health and health teams in countries where concern is working, where the health system was already fragile and weak in countries like Chad, Sierra Leone, Liberia, Pakistan, Bangladesh. I mean, it's not like these countries had excess resources. They were already being challenged in terms of quality service delivery and increasing infectious diseases as a result of lack of access to clean water, sanitation, and the ongoing diseases of poverty, including malaria, where people can't always afford to sleep under a mosquito net.
Mm.
Thankfully, we don't have those infectious diseases in Ireland, but as we're learning with COVID-19, we're on this one planet now, and I think we can learn a lot from responding to the HIV and AIDS global epidemic to bring to supporting the ending of the COVID-19 pandemic.
Okay, we move on to talk about HIV and AIDS. Last week, the meetings of the G7 got most of the national and international media attention in relation to international cooperation, but there was also another series of meetings last week at the UN, weren't there, about the global response to try to end HIV and AIDS. Could you tell our listeners on Near FM more about these meetings at the UN, please, Breda, and tell us whether you think we should be happy with what was agreed at the UN last week?
Yes, there was a high-level meeting participated by all UN member states between the 8th and the 10th of June 2021. The last meeting was held in 2016. This meeting was looking at progress made, but unfortunately the 2020 targets were not met, interrupted by the COVID-19 outbreak last year and other issues, and a declaration was agreed as a springboard for action for the next 5 years so that we can help reduce HIV transmission and increase access to people living with HIV so that they can live healthy lives. 2021 marks 40 years since HIV and AIDS began in 1981. And it's 25 years actually since the creation of UNAIDS. It is unfortunate that the targets for 2020 were not met, but thankfully the new political declaration has been more or less agreed by all UN member states to reduce and prevent HIV-related deaths by 2030, but a lot more remains to be done. I mean, in Ireland, we had Irish AIDS Day on June the 15th, just 2 days ago. There's more than one person diagnosed with HIV in Ireland every day, and globally, over 4,500 new HIV infections daily. Yet HIV is technically 100% preventable. And the main drivers continue to be, I think we discussed this before, Darren, poverty, inequality, injustice, no access to testing and treatment, the stigma and discrimination that's ongoing. And it's hard to believe that, AIDS remains the leading cause of death of women of reproductive age in countries in Africa and Asia. And every week, over 5,500 young women become infected with HIV. Still today, 38 million people are living with HIV globally, and 1.7 million new infections last year. The new political declaration is focused on ending the inequalities which are driving HIV and AIDS in terms of risk and vulnerability, especially for women and adolescent girls. And in fact, the title is Getting on Track to End AIDS by 2030, SDG 3, Sustainable Development Goal 3. But a lot needs to be done if we're to get back on track in terms of leadership, commitment, again, strengthening health systems, early testing, putting people on treatment, which is life-saving, people living on antiretroviral medication can live the same life expectancy as almost everybody else. But the interruption, especially of the COVID-19 pandemic, on health service delivery, like I said earlier, and uptake of health services is going to be problematic, I think, for the rest of this year.
Okay, and was there any increased funding announced at the UN last week, Breda?
Not immediately. Pledges are being made, but moving pledges to commitments is an issue, and unfortunately we have learned that the UK government is reducing their aid commitments as a result of the impact, they're saying, of the pandemic in the UK over the last 50 months. This will not be helpful. Thankfully, Concern's main donor, Irish Aid, remains committed to reaching 0.7% of overseas development assistance. But a lot more will be needed to support getting the Sustainable Development Goals on health delivered by 2030. And in some countries, the rights of people living with HIV are not being delivered on. More conservative governments, lack of leadership, is forcing people who think they might be infected not to get tested, to go underground, which obviously then results in more people becoming infected with HIV. We have to follow the science. We know how to prevent HIV. We know how to treat HIV. And we need to do more to stop every person becoming infected. Leading by example in Ireland. I mean, more than one new case diagnosed in Ireland every day this year so far. And that is probably an underestimation, as in globally, because people are not going for testing due to so many of the services not functioning, and people are afraid of contracting COVID. So we have a lot to do to try to achieve targets before the next UN high-level meeting in 2026, 5 years away.
Okay, Breda, just have another couple of questions. I won't keep you all day. Talking about the global picture, we've discussed this before many times, but a lot of people I don't know this. Out of all the people who have HIV on the earth today, only approximately half are on treatment, aren't they?
It's higher now. I have to get the latest statistics, but there's probably up to 75% of people who are living with HIV on treatment today. But there's still
that's very
too many
good.
people not accessing treatment. There have been improvements, and like I said, in 2019 there were 38 million people living with HIV. 25 million of those were on treatment.
So 75%.
Sorry, it's 67%. 67% of all people living with HIV were accessing treatment in 2019.
That's a big improvement.
Nearly 70%. But that probably has not risen in 2020, again due to the non-functioning of general health and HIV services in many countries. And again, it concerns target population, remote, rural populations, people living in urban slum areas, people who do not feel comfortable going for testing. They are often the last to be served in terms of accessing the testing and the treatment. And, a young population, increasing young populations in Africa and Asia don't remember the worst days of AIDS in the 90s and 2000s, luckily for them. So the fear isn't there. There's a bit more complacency. But unbelievably, I mean, almost 80 million people have become infected with HIV since the start of the epidemic. And 33 million people have died over the 40 years.
Okay, Breda, do you want to come towards the end of the interview, tell me a bit more about Irish AIDS Day 2021, which is on Tuesday. And I know you're involved in the response to HIV and AIDS since the 1980s in Ireland and other countries. Can you tell me just a bit more about kind of your reflections over the last 40 years?
Yeah, my first work on HIV, John, was in St. James's Hospital as a young nurse in the worst days in the late 80s, when even in Ireland at that time we did not have treatment. Everybody died. A lot of people will remember the wonderful DJ Fab Vinny, who opened and broke the silence later when people found out that he had died of AIDS-related illnesses. Freddie Mercury later, in terms of Queen. I mean, people speaking out and breaking the silence are critical. And living in Ireland, working with Concern, I think it's important that we lead by example locally and globally. We need more testing and treatment services opened, functioning within the confines of the safety in terms of COVID-19 ASAP, as soon as possible, here in Ireland. And I've been working with ACT UP Ireland, ACT UP Dublin, advocating for the opening of the sexual and reproductive health services so that all infectious diseases, including sexually transmitted infections, can be diagnosed early for optimum treatment and prevention of transmission to other people. Prevention is best. Every World AIDS Day, we work with Irish Aid on the Father Michael Kelly lecture, and we'll be marking 40 years of AIDS on December 1st coming up this year. But again, with Irish Aid, with our partners in DOCUS, it's important we support the response locally and globally. Some people living with HIV in Ireland, are from countries where Concern is working. Speaking out, breaking the silence, educating everyone on how HIV is transmitted, how it's not transmitted, and how we can protect ourselves. As with the COVID, the mask, the hand washing, the physical distancing. For HIV, likewise, knowledge is power, and particularly to protect young people and young men and women, adolescents in the countries where Concern is working. If we don't lead here in Ireland, I think it's very difficult to lead globally. I'm hoping Concern, Irish Aid, ACT UP Dublin, we will all work together. Every infection averted is success in terms of progress. But it's way too much that every day still, over 4,500 new HIV infections are passed on, when HIV is technically 100% preventable. We need to deliver on the Sustainable Development Goals, SDG 3, and 2030 won't be long coming. Investment in health is wealth. Surely, if we haven't learned this 15 months into this global pandemic, I think we need to ask ourselves a lot of questions. At the worst days of AIDS, children were dropped out of school in many of the countries where we were working, Uganda, Zambia, Malawi. Livelihoods collapsed as adults died. We know the impacts, so we need to prevent and treat, test and treat, and work with people to reduce stigma and discrimination so that the rights of people living with and affected by HIV are protected.